everybody. Welcome to our podcast. We are honored to be joined by Dr. Girish Mood. Dr. Girish is an experienced cardiologist with a demonstrated history of working in hospital and healthcare industry. In addition to his role as a practicing cardiologist in the USA, UK, and India, Dr. Girish has a unique focus on a holistic approach to healthcare. He equally dedicates his time to balanced farming, social awareness through health camps, and fostering connections with the youth in the Karnataka, India. Dr. Girish multifaceted expertise and commitment to a well-rounded approach to health make him a truly distinguished guest. Welcome, Dr. Girish. It's a pleasure to have you here with us.
Oh, thank you so much.
Yes, and Dr. Girish, as you have deep understanding of the challenges and opportunities in India's medical education landscape, we are eager to hear to your perspective on it. So, the first question I would like to ask is the quality of medical education is a critical concern. So, how can India maintain high educational standards while expanding its medical institutions?
Thank you, Harshita. To start with, what I would like to do, if you permit me, is just take you back with my medical education, which I completed in 1995 here in India. Following that, I did work as a senior house officer in the UK health system in London, mainly with Guy's and St Thomas Hospital. And after that, I did do my residency in the US in internal medicine, then fellowship in vascular medicine, cardiology, interventional cardiology, and so on. So now I would like to put all my views with all these exposures in different landscape, and also compare between what it was, say, 30 years ago in 1995 when I left medical school to what I am now. I am actually it's funny, I don't know how to put it, even though I joined medical college here as a faculty, and that is a little bit debatable at the moment because of the system. So I don't want to get into that aspect of the system because then it will be too deeper fault in the system. But then, see, when we were studying, when we were doing our medical education in India, now that I'm a cardiologist, when I look back, when I was completing my internship, I can say that, I was not at all confident with reading ECGs. Okay. But there was an element where we were trained very good with the practical aspect because our mentors were phenomenal. Those were not the days when we had these advanced technologies, CT scan and MRI scans and so on and so forth. And I still remember most of my mentors, and I've been fortunate to graduate from Bangalore Medical College. So most of my mentors were fascinatingly clinically sound. I mean, their clinical acumen and trying to teach us how to elicit symptoms, how to elicit the signs, and then come into a probable diagnosis and then go with the treatment, right? Now, the medical field has progressed leaps and bounds significantly over the last 3 decades. And now that I come back here in India, and then when I look at my interactions with the medical graduates, like the fresh medical graduates, and let alone experts, I mean, and this was very evident when I saw some of the experts coming onto the screen and then talking about during the pandemic time. I will not mince my words. I was disheartened. I was like, we haven't changed much yet. Even though the technology is going so much faster, we have not changed the way we think. We have not changed the way we look at the society. And unfortunately, we have gotten too capitalistic in our approach. And when now that I connect with the rural families and the healthcare delivery into the rural system, I see a huge disconnect here. And it's there is a lot of room to improve, but unfortunately that be it political will or be it professional will, I think it is severely lacking. I mean, this is a glaring change. Now, if I have to again step back and then make this statement to not just to Indians, I think this is a problem across the globe. The definition of health, according to the World Health Organization, is in a simple sentence, it is a sound mind, body, and soul. Right? It's not just disease management. It's a sound mind, body, and soul. It's entirety. It's how we look at even society is also a responsibility of a medical professional. I mean, as a cardiologist, I can tell you that so many of those patients I see with anxiety, panic, atypical chest pain, lifestyle diseases, they revolve around their professional and family life, let alone the social life. And the understanding of all of this into the medical professional or healthcare delivery professional is even more lacking. It's even more concerning, I should say.
Yes, we definitely need to revamp the medical education and the overall system, healthcare system in India. And now, Doctor, could you, since we are talking about the quality of medical education, so the quality also varies widely across institutions. So what measures should be taken to ensure a more consistent standard of education?
Again, if I have to step back and then think about the medical education per se, right? The major fault I find in the Indian healthcare delivery, healthcare system, or the infrastructure is, believe it or not, I think the major fault is in the focus on the meritocracy. When I say meritocracy, we believe that, just because you can score 99% in the exam, we feel that, you are going to be a good doctor, right? And this is a huge disconnect, not just from the administration, but even at the society or the social aspect. Because a good doctor is not someone who can just write a prescription or spend time with whatever he wants to speak. A good doctor definitely has to carry compassion and empathy. Because if you and me, when we go to a doctor, what we are looking at is that component as the most important one. It's not medicine. Because if it was just about writing medicine, a pharmacist will do it. And the unnecessary focus onto the meritocracy. And I also want to highlight the way the NEET system works on picking up these students is not the right way. Absolutely not. Because now I'm looking at India as a whole, right? If I have to give you an analogy, just because a BMW car runs good in Germany in an Autobahn, where you can go at whatever speed, I can't get the same vehicle here in India and then say, hey, I'm going to drive it this way, right? I have to look at what is the surroundings here in India. So with the recent reference where the central government came up and then say, they are going to provide free ration to 80 crore people of India. Now, if I have to take that just itself as a reference point, these are the people probably who are below the poverty line, that who cannot afford even for their basic nutrition, basic food. And this is widely divided across the Indian subcontinent. The geography, when you look at, there might be a South India compared to the North India, if you look at, or even in South India itself, if you look at Kerala, or if you look at Karnataka, if you look at Tamil Nadu, and then you look at Bihar, Madhya Pradesh, or Uttar Pradesh for that matter. When we try to look at all of this, the fabric is not even across the state. Even within the state, when you look at the major metro and to the suburban and the rural, it is not even at all. And you have 90% of the healthcare delivery done by the private partners, whereas 80 to 90% of the people who are living on the social welfare, right? So with this huge disconnect, now if you say what kind of a healthcare system or an education do I want to have for my people in India, I think just having a standard curriculum is not going to be enough. You have to know your local surrounding, local society, the local dialect and language, because we also know as a medical professional that when you communicate in their own language, they understand better than what I speak in my medical dialect or in English or Hindi alone, because India is a land of multiple languages and culture. So I think, yes, it is a Western medicine, but then when we are trying to apply it to a society like India, I don't see there has been much change in the way we think, where we train the graduates. And hence, when you look into different colleges and the way it is delivered into the students or taught into the students also varies significantly. I'm like, now, I've lost a hope that when somebody says I'm a gold medalist, doesn't mean to say that you know everything to communicate with the patients or with the family or with the particular community. It doesn't mean anything. So I'm being very critical because I love my people. Having seen what I've seen, what the advanced education and the system and the technology can do, do we have a room here? Of course. We have a beautiful, talented pool. Unless and until you mix the existing teaching faculty and the brain with the new trainees, those who have trained outside, who have seen outside, if you don't mix it, then the outcome is not going to be any different.
Yes, doctor. And how can we address this urban-rural divide healthcare access?
Okay, so for that, I would say, see, if somebody likes it or not, it's okay. But then, when I look at the healthcare setup, which was there decades ago, like you had a public healthcare unit and public healthcare centers, that is the PHU and PHCs, which were pretty much catering, and people were able to reach close to their proximity, not necessarily coming into the urban population, right? I mean, even at the rural level, there was one or the other healthcare center accessible. Over the decades, agreed that the human demographic has spread wide, they've gone even more wider. But the starting of PHU or PHCs has not been even. On the contrary, you see that the private players are all focused in the business districts, in the areas where they feel that the revenue generation is good, right? So with these institutions being focused in one place, even the professionals will end up being focused on one place, then naturally there is a significant divide. Okay? And with that, when you add the ever expanding gap between the affordable and unaffordable people, it is making even more worse for the suburban and the rural to get a quality care. The healthcare expenditures, I just had a reference, a second opinion this morning, which was a 46-year-old gentleman from a rural side. And he went to the local hospital with typical classic chest pain and shortness of breath. And I saw the EKG, and the EKG showed what we call as an acute heart attack. That is, it was an inferior wall STEMI or ST segment elevation myocardial infarction. Along with that, he had what we call as a complication of this heart attack as a complete heart block. So in a nutshell, this is a severe or a very critical case which needs immediate attention, right? And here, poor guy, because he could not afford, even though he has got the BPL card, which is below poverty line card, he could not get the best treatment, which is primary PCI. That is, he needs to be taken to the cath lab immediately. That blockage needs to be opened within 90 minutes so that you save the muscle from being damaged, and also you save the future complications. But this guy did not get it. He got traditional medical treatment. And then just half an hour ago, when I spoke to the cardiologist over there, he says, well, even though they have the below poverty line card, that does not cover acute presentation. Now, after 3 or 4 days, or say in a week, the same patient can get the desired treatment under the same plan, but not when he came acutely, when he actually needed the treatment. See, after 1 week, whether you do it or not, the damage is already done. Not everybody requires it. So you have a system, but it is not really there to help the patient or change the outcome. So now the question comes is, how can we improve this divide between urban and rural? I think, not just improving the quality of education, it also requires a serious thought process from all the stakeholders. And here, this was a center which is run by one of the experts who does interfere at the policy making. He does give talks across the globe, but it's that center which is not able to make much changes to the people, and that's the irony we have in the healthcare here in India.
Yes, doctor rightly said. And as previously you said that we need to have a standard curriculum. So the curriculum and training for medical students often focus on theoretical aspect in India. So what steps can be taken to provide students with more practical experience, especially in handling health issues specific to India?
So I was able to once again interact with some of the recent graduates. I mean, some of them are going to be graduating in the coming months. I talked to them. I spoke with them. I said, I need to prepare better for this interview so that I give them the perspective, right? So whatever the training was when I did, or 30 years ago, and when I spoke with the students now, we are still following pretty much the same path, where out of the 12 months, you can relax for 10 months or 11 months. And if you are a very good person who can rote learn, just, review question papers and you practice your answers repeatedly, you go to the exam, you vomit it out, you get a gold medal or you get a rank or you pass. You graduate as a doctor. But we forget that a medical education is a continuum evaluation. It's not just a one focus point where you call this person as, he's a gold medalist and now he can recite all these textbook chapters very well and now he's a good doctor. No, it is not. I think what I want to see the change is the evaluation has to be reciprocated, in the sense the students also has to evaluate the teacher. The professors needs to be evaluated here in Indian healthcare system. It's very critical. This is very much needed. And at the same time, the students need to be evaluated at every juncture, at every month or every postings, every level. This is and one other thing which needs to change in the Indian education system overall. It's not about pinpointing and then fingering or vilifying. Oh, you're a bad student, you're a good student. No, this is not, and this has been the tradition of Indian education. Just because you get a first rank, we think that he was born, from the top. No, it is not. Nothing like that. In fact, the education system should identify those who need extra help. You put your resources and focus, because at the end of the day, what I want is more number of good doctors. I don't want someone to carry certificates and who doesn't know how to speak to the patients or how to empathize with the family, right? So the curriculum-wise, what I am really hoping to see, and previously it was Medical Council of India, now it is a National Medical Council, that is NMC. What they really have to do is instill a continuum evaluation. I was also told by the students that they have these meetings. Now they are making changes, on the papers, right? Where the students are allowed to sit together and then discuss and debate. But then if you're not getting in new ideas, new ways of educating, and if you are utilizing the same resources, which was always there the last decade, I don't know how you can expect them to deliver anything different. No matter what kind of system you want to change on the paper, the outcome is not going to be different. And I would also want to add that this was my quiz to some of these students. So how many of you are comfortable reading ECGs when you graduate, right? The number is still very small. They are trained towards, and in the final exam, they have what is called as a long case and the short case. Okay, pretty much every medical college, they train these students towards the probable cases which are going to come in the exam. So the same cases are going to be discussed in their rotation or the hospital rounding, and they are basically trained to answer those questions during these final exam, and then they become doctors. No, that's not how I think the medical education should be. It's not, you don't have a set, cases for these exams. Every day is a different case. Now, COVID may not come tomorrow, right? So, or the multi-organ failure may not come tomorrow. But then whatever is current going on, healthcare disasters, that is what we want to educate these students on. I mean, I can go on and on. I think this is a very short interview, but then I'm just trying to give you the gist of it, where I am still kind of sad that the system has not changed significantly yet.
Yes, and doctor, we have also seen that international migration of Indian doctors or medical professionals is a common trend. So how can India retain its medical talent while still contributing to global healthcare workforces?
So, I mean, on one hand, I am not opposed for doctors if they want. You are entitled to go in search of whatever knowledge you aspire or you desire to get. But then what it speaks about is how the system within India is not attracting these youths or these doctors to stay within the system, right? Why do they want to go back? I mean, maybe it is the quality of life. Maybe it is the quality of education. Maybe it is a balance between life and your personal life and professional life. And maybe you are not victimized in the system. You get a fair play because, for that matter, the medical professionals are doing their best. I mean, they actually sacrifice a lot to take care of all the natural related disasters. And let me also add there is more increased human-made disasters, whether it is capitalization related, whether it is urbanization related with its pollution and so on and so forth. I mean, we are now seeing multiplex of issues and problems. They're not simple. They're not just straightforward where you see a scratch and then you put a band-aid and you're done with it. No, the complexities are increasing. So in that aspect, I am fine with professionals, whoever want to go out. But then India has to create an environment so that hopefully they'll come back. And then I'll give you my example. After 18 years, I came back to India, and I didn't want it to work. I mean, I thought maybe I can work with corporates, but I chose not to. And then I wanted to be in the academic setting, and then I enjoy teaching. So I went to the academic center, one of the academic institution, and they said, well, your training is probably not recognized in India because all I have is an MBBS degree from India and everything else is from outside. So then I had to write letters to the MCI, and then I wrote a letter to the PMO office in 2016. And 2017, there was an addendum to the teaching eligibility committee, that is tech committee. They amended saying that, okay, fine, individuals who have gotten these trainings in 5 English-speaking countries are allowed to, they can work in Indian healthcare system at the same level. But then I actually spoke with one of the director of the NMC and many MCI people, local people. I said, a professional who is working outside India, yes, he gets training, but at the same time, he will be working a little bit beyond after his training over there. And most of them are affiliated with the academic institutions over there. So you should have a way to recognize those experiences as well when they come back to India. Until now, I have not been able to convince even the NMC to say that, yes, I've had, academic experience over there. Please count that in. But no, their amendment says that, if you come back, you're going to start at the lowest level. Now, how are you even encouraging? Yes, on the papers you have, we are going to recognize. But then let's be practical. Let's be practical and then say, so if the medical education system, and also the irony here is, very well, most of the guidelines we follow in India are all either from Europe or US. So now here I am, I've gotten the experience from the place where these guidelines are made. I can probably interpret better, but then no, I don't have the room. So I think that's a little bit of a kind of an oxymoron state situation where how are we going to change it? How are we going to improve it? And let me add this one other aspect in the education system here in India. Focus on research is very, very poor. Be it the professors or the teaching faculty. And from there, if it is not there, then the students are not going to get any idea or exposure into the research methods, research implications, how to differentiate between which study makes sense or whatnot. I mean, you can read the conclusion, and then if you want to practice, you might practice according to some random study somewhere. But then if you don't expose the students to the research world, how are you going to make the difference between whether this is going to apply to my patient population or my community or my system? Now, if I have to, this is a problem with the system what we have, the culture what we have. We've always, if you question ourselves, why do most of the people want to be doctors? We might say that, I want to serve people and so on and so forth, which is good in the beginning. But then when it comes to the bottom line, if you look at all those who were gold medalists, who were toppers in the class, now how many of them even go to the rural system to serve the rural population, right? Negligible, right? So here, what we have created is a kind of a false hierarchy. Oh, if you are an orthopedic, if you're a surgeon, if you are a cardiac surgeon, if you're a neurosurgeon, your revenue generation is going to be good, your glamour life, your luxury life, your comfort, and so on, so be good. So within the medical or the healthcare system, we have created this hierarchy, right? And even within the system, we don't have that dignity of labor either. We kind of look down upon someone who is a preventive and social medicine expert. And the funny enough was a couple of years ago when the pandemic happened, who are the ones who, should have been given the preference? It was these people, the microbiologists, the pathologists, the P&SM people. But who did we see on the national television? Totally unrelated professionals behaving like experts of pandemic, experts for viral illnesses. So in a system, we have also encouraged this kind of the dubiousness, right? So naturally, when a young mind who's looking for a profession will start thinking, oh, do I want to be in this particular field, or do I don't want to be in the particular field? India is a place which has got opportunities for pretty much everyone, not just medical, even dental, of course, even Ayush, Ayurvedic and other allied specialties also have a role. It is not, and I recently read one other report from which was presented in the Lok Sabha, that now currently India has one doctor for every 834 people, which is better than what the WHO recommends, which is fantastic, good. So now, if that is the case, what are the markers of healthcare indicators in India? I'll leave the cardiology. Let's look at other aspects: nutrition related or malnutrition related illnesses, whether it is cancer, whether it is dental hygiene, whether it is mental health. Yes, we have doctors, but we are not having an effective outcome. Yes, we have hospitals, but we are not having an effective outcome. Yes, we have multiple specialties, multiple colleges, but we are not having an effective training. So, but there is room for a change. There is room for, an improvement. At the end of the day, what I believe in is not the GDP of a country. I believe in the HDI, which is the Human Developmental Index of a country. It's because it's not how long you live, it's how well you live is what I believe in.
Yes, doctor. And doctor, how does India's medical education system compare to global standards? And are there any initiatives in place to align it with international best practices?
I'm going to divide it into the theoretical and the practical aspect, right? Okay. When it comes to the theoretical aspect, our students fare better because they are good at rote learning, or they're good at cramming up things and so on. But then when it comes to the common ailments, common diseases, I see there is a lacking in that. But when it comes to, reading these textbook related rare disease, where when you talk about it, you feel good that only I know more about it and then you don't know anything about it, kind of, I think, that way, yes, when you go to the Western world, you are trained deeply into the current disease spectrums, right? Not about some rare diseases or some uncommon diseases. But then on the other hand, when it comes to the practical aspect, before, yes, India had a wonderful setup where you were practically good, because we had to get on We had to get hands-on experience for pretty much everything. Now that is lacking in India. And this, I am going to reference it only to the undergraduate, right? Say once you complete your post-graduation, if you are willing, if you are very keen on that, then the patient population is huge in India. If you are motivated, if you are dedicated, yes, you can keep doing the same surgery over and over again, and then you can be the master of that surgery. And that we see in cardiac surgery in India, or even in cardiology. You are doing the same procedure. It is a repetitive process. So you are excellent, you're good. So when you compare with outside world medical education and then here, I think there are multiple variables at undergraduate level, postgraduate level, and even after you complete your post-graduation and then when you come into the practice, there are multiple variables here. So I don't think we can just put a simple hard facts and then say that this is better and this is not good or quite. No, I wouldn't say that. There are things lacking even in the Western world, no doubt about it. But then one thing which I really want to highlight here is that, the compassion and the empathy, or the patient-centric treatment, the family, the patient-centric treatment, that is phenomenal outside. And I wish to see that in India, not just for those who can afford, even for those who cannot afford.
Yes, Dr. Girish, thank you. We had a great session, and thank you for sharing your insights on medical education in India. And we appreciate your valuable contribution. Thank you so much for joining.
Thank you, Ashika.
Yeah, and to our audience, please stay tuned in for more engaging conversations on important health and technology topics. Before we say goodbye, I encourage you to explore our MedSynapse platform. It offers a unique opportunity to engage in enriching discussions, connect with esteemed medical professionals, and contribute to the progress of healthcare. Until next time, stay informed and inspired. I'm your host, Dr. Harshita, signing off. Goodbye.